And we know that hospitals across this country have already postponed elective surgeries and appointments, really anything not considered essential. That includes organ transplant procedures. Hilary Johnstone has the details from Ottawa.
When a person dies, their organs need to be transplanted quite quickly. But right now in Ontario, many hospitals are postponing transplant procedures unless they're absolutely necessary. What that means is that good, viable organs in some cases aren't being procured, meaning they're not being recovered from a deceased donor. That is according to Dr. Atul Humar. He is the director of the transplant clinic at the Toronto General Hospital. He says that it is not currently possible, the technology just does not exist, to take organs and to put them on ice and store them for a transplant at a later date. So what is happening, in his words, is these organs just aren't being procured, they're not being recovered since they can't be used right now. He says that many patients can actually safely postpone their transplant procedures. For example, someone who might be waiting for a kidney, he says in most cases they can safely wait on dialysis. So that is what some people are being asked to do right now. He says that it is, of course, very unfortunate that some good, viable organs aren't being used right now, but he says we are in an unprecedented circumstance and that, unfortunately, that is what needs to happen. Take a listen now to what he had to say.
Well, to be honest with you, it breaks my heart. Every transplant that we do is a life-saving operation. And, I just hope that over time this pandemic abates and we can restart and ramp up our transplant program.
Now, there are two reasons why Ontario hospitals are delaying some transplant procedures. The first is because they want to make sure as many hospital beds as possible are available for the anticipated influx of COVID-19 patients. The second reason is because once a patient goes through a transplant, if it's been successful, they are then put on anti-rejection drugs, and that medication suppresses your immune system. And of course, right now, in the face of COVID-19, it is not ideal to have a weakened immune system. The Trillium Gift of Life Network is the Ontario government agency that is responsible for organ transplantation and donation, and it says that delaying some of these procedures is necessary in order to ease some of that strain on Ontario's healthcare system. It also says that any patient that has their procedure delayed because of COVID-19 will not lose their spot on the organ transplant list.